Hello and welcome to everybody to our Sunday webinar with Magic of Holistic Health. I am Dr. Saurabh Pidani and I have a very special guest today. I have Dr. Govati, who is a dysphagia and a speech therapist, speech specialist, and a researcher in dysphagia. She's published over 30 plus national and international papers, received national and global healthcare awards as the best dysphagia specialist and researcher, and she works currently in Medanta Hospital. Welcome, doctor. How are you? I hope I got everything right in your introduction.
Yeah. It's absolutely right. Thank you so much for inviting me for the session. Thank you so
Most
much.
welcome. And we have this amazing number of people who watch this webinar every Sunday, and we do different topics. So this month, I believe, is also something to do with dysphagia. Is that correct?
Yeah. June is a month for dysphagia awareness.
Dysphagia. Okay, perfect. So it's not dysphagia, it's dysphagia. I'll get that right now.
Yeah.
So let's jump in for people who are watching, and let's ask you, what is dysphagia? So how do you define it? What's it all about?
So basically, dysphagia is difficulty in swallowing. So anything they are facing difficulty to take it down from oral cavity to the stomach. Basically, what in normal, before talking anything about dysphagia, I would like to say what is normal swallowing. What we eat in our daily process, we take a bit of bolus and we chew it and we take it we swallow it, right? That goes from oral cavity to our throat and then it passes into the stomach. So these are the three stages of normal swallowing. If any of the stage has difficulty of passing the bolus or from that particular phase to the another phase is called dysphagia.
Okay.
Inability to swallow food, liquid, medicine, anything, whatever we like to eat in our daily life.
Okay. So as growing up, I could never swallow pills. Is that also dysphagia, or that was just my psychological thing of like not being able to swallow at all?
Definitely some people face difficulty in according to research, almost 11% of normal population will also face dysphagia in their regular life.
Okay.
So eating pills, like, there's some type of technique where you have to take the water first and then take down swallow. So you have to just still down the head and then take it down. So there are some strategies.
Yeah. All right, awesome. So before we go further, I want to understand, how did you get into this specialty? What made you believe that this is the place that you want to focus on? So tell us a little bit about yourself.
Basically, to be frank, I just came to just see roam all around the Delhi and all, just like that, not with the mindset like, I have to come do all this research, I have to go in depth into the dysphagia and all. But once when I stepped in here, I was like, I got a good platform and good opportunity to handle the cases and to see, like, it was quite interesting. And I wanted to learn more what is this, and then that's how I started, like, this is something which we cannot see visually. All other diseases or all other some diseases, like, which are visible outside, where we can feel that. But dysphagia is something like, it's a hidden terminology where people think that they are eating normally, but really in patients with like neurological disease, they don't eat normally. So this is like, until unless they open their mouth and they say that they are facing the difficulty, people can not really identify that. So how we can, how we have to judge it is that patient is having difficulty in dysphagia, or like, how we have to identify whether patient is really aspirating, how we have to treat them. Like the interest which made me like, I used to handle a neuro patients first. Then I thought like, whether is it similar in onco patient also? Is it similar in respiratory also? Like what would be the changes? That's how it has been started. That's it.
Okay.
So at the same time, I got a better platform to learn more and come up with like, more researches and all. That's how it's like coming out.
Awesome. Thank you so much for sharing this. So the next question that comes up is how to identify if somebody's got dysphagia.
Okay, so I answer to this question very generally, because the signs and symptoms differs from patient to patient and from the disorder to disorder based on severity and this. But in general, if any of you notice like with your loved one or any patient, if you see, or if anyone are facing this kind of symptoms, signs and symptoms, please do approach dysphagia specialist. The signs are like, whenever we eat, if you are unable to chew the bowl of food properly, or drooling out whenever we eat, drooling out the food, or whenever you swallow, you feel like food stucking in your throat, or whenever we eat, we feel some chest burning kind of sensation, or some sort of regurgitating or vomiting, coughing whenever we eat, when we cough or choke, or we have some sort of like, respiratory distress or incoordination whenever we eat the food, or like, we put a lot of effort to swallow. We sometimes, tend to modify the diet, like, we come to solid diet. Agar in case if I'm not able to eat solid diet, then I try to blend it and eat, or I make it
Right.
completely liquid and eat. And after even I'm not able to take that liquid, then I try to approach the doctor. Instead of that, if
Right.
you try to identify, like, why am I not able to swallow this solid food at this particular day? Why am I facing all these issues? Then you have to immediately, if you find all these signs and symptoms, like, food stucking in throat, heart burning sensation, vomiting reflexes, GERD reflexes, or like, choking, coughing, or taking water frequently with each and every bolus, so immediately do approach or see the consultant.
Awesome.
These
Thank you
are the
so much.
signs.
Yeah.
These are the signs where we can identify actually.
Okay, perfect. So I think our viewers would be taking note of that and now figuring it out themselves. Am I going through this? So one thing note, please don't start doing research online for it. If you feel certain symptoms, please approach a doctor, because I have been told and was told multiple times that your online research can take you anywhere. You just need to actually consult a specialist and do that. So coming back to it, whom should you consult if you're diagnosed with dysphagia?
Yeah, basically, a dysphagia specialist will be dealing with all this swallowing related issues, or a speech language pathologist will be helping you out with this. Or else, if
Okay.
you consult any of the physician, they will be recommending you to they should recommend, and they will be recommending you to the dysphagia specialist or a speech language pathologist. Like, in
Okay.
some general, public get tend to, like, they get confused where should they go. Sometimes they go to ENT specialist because they feel some throat pain whenever they eat, so that's why
Right.
they go to the ENT specialist. Or they feel gastritis issue whenever they eat, so they go to the gastro department. Or now, like, I've said all the signs and symptoms. If they notice, they can directly approach a dysphagia specialist or a speech language pathologist. Most of the time nowadays, they are available in all acute care hospital setups.
Awesome. Thank you so
Yeah.
much. And who are the high risk groups for this? Who are identified as the
Like
high risk
most of
groups?
the time, old age population are at high risk,
Okay.
and especially if we talk disease related issue, like, neurodegenerative disease patients, or like head and neck cancer patients, respiratory patients are like more at high risk.
Okay.
Yeah.
And what happens if we don't treat dysphagia in a timely manner?
See, basically, that's what I said in previous, like, in your question. If we come, see, if I'm not able to eat solid food, what I do immediately now, I have like lack of acceptancy, to be frank, because first of all, we are humans. We don't accept the things immediately.
Right.
Right?
Right.
So if I am not able to eat solid food, then immediately I'll try to blend, or I try to modify myself, head tilting or sleeping, lying down, or lifting my head and taking it down. I try to find out somehow the other way to take it down, but instead of accepting that, or instead of ruling out, checking out why is it happening, or like, in that way, this thing doesn't work. Basically, if you like, face this kind of issue, immediately consult a dysphagia therapist. They will help you out why it is happening and what need to be done. If we ignore this dysphagia, if we are not like neglecting, compromising with the diet, or just tilting your head, or making your diet, modifying everything, or turning into liquid diet, taking your liquid diet, all this will get compromised with your nutrition level, and that may lead to malnutrition or dehydration. Or
Got
if
it.
you tend to, or sometimes, the patients, or like, normal population, they tend to like compromising with the diet pattern will lead them to malnutrition and dehydration, or like, changing their position, eating, swallowing in wrong way, swallowing in a wrong pattern will lead them to aspiration. Aspiration is like, in our throat, our windpipe and footpipe are together.
Mm.
Whenever we swallow, our windpipe will close and food pipe will take the bolus and pass it down into the stomach. But
Mm.
in if we swallow in a wrong pattern, our food pipe will catch the bolus and take into the windpipe. Because
Mm.
of which that will create the aspiration, lungs infection, pneumonia, and sometimes death also.
Mm.
So
Okay.
this should not be ignored. So this, if we ignore this, if we neglect all the signs and symptoms, this may lead to your nutritional compromise, and this may lead to your aspiration pneumonia, and further it may also lead to sometimes death. So it is very
Okay.
important to identify at a right time and
Mm.
approach a right person.
Thank you so much, doctor. I think it's just it's I think a lot of things to chew on for people. But let's go move quickly on to the next question, which is there an established cure to treat this condition?
Sorry, I miss your voice.
Is there an established cure to treat this condition?
Yeah. We have a dysphagia rehabilitation for this. A basic, in order to talk anything about the management related thing, first the assessment is a baseline where we have to check with. Based on the type and severity of the disease, there are certain therapeutic management and medical treatments as well. So it is completely based on the assessment and severity. We have some dysphagia management where we have sensory therapies and vibratory therapies, electrical stimulation therapies, diet modifications, compensatory techniques. All this by following, if we especially talk about like some neurogenic patients, so they have some based on their severity, we plan a particular diet modification therapies, compensatory techniques, and therapeutic manage will be planned, and we'll go on this platform so that the patient will be able to have a safe swallow and have a better quality of life.
Awesome. So a follow-up question on that then is, how can one manage dysphagia in a severe or an acute condition?
See, that's what, if the in neurodegenerative cases, as we told, if they have been approached very late, or it has been the severity is very bad where we cannot do anything, in that cases sometimes we suggest the patient to go from the peg tube feeding in order to maintain their nutrition level. At the same time, we also work upon the dysphagia management. Either we work upon the electrical stimulation, or we manage on some active perioral exercises, where in order to control or maintain the muscular movement and muscular coordination. Along with that, also we'll also train the patient caretakers to maintain the positionings, which is very important, so that the patient should not aspirate.
Okay.
Yeah.
And as following up on this now, are there any quick tips, maybe 2 or 3, that a dysphagia patient who's listening can follow to help them with their condition?
Yeah. So basically, these are the casual general tips, not specifically for one particular patient. Even we can follow, and whomever we are seeing, we are treating the patient, they can maintain whenever they are treating the patient as well. So whenever we eat, we have to make sure that we have to sit in a 90-degree sitting position, and we have to take a small volume of bolus. We have to masticate it properly and swallow slowly. Try to avoid the distractions and stop the TVs whenever you're feeding the patients. And do not feed the patient in lateral position, and do not make lie down immediately after eating the patient. And make sure that give a voluntary pauses, whenever you feed the patient, give the voluntary pauses after every 5 to 10 spoons. Okay. If they have any difficulty in swallowing, solid foods and all, try to make it soft and talk to the dysphagia specialist and try to feed them, and do a regular oral exercises as recommended by your speech therapist if already you're going through, so that you can maintain the stability and stay on regular touch. So tips varies from patient to patient, but these are very general where we can follow in our daily lives. That's it.
Thank you so much, doctor, and thank you so much for your time. I think there's a lot of information for people to take in and, of course, follow through this, because it's very important. Honestly, I had no idea of dysphagia much before I started talking to you, so I got a much deeper understanding of it. And I'm sure there's multiple people who are suffering from it or who don't even realize that they are. I think it's important for them to reach out to a specialist like you. I believe you are in Medanta, Gurgaon, right?
Yes.
All right. So for all the viewers, she's based in Medanta, Gurgaon, so you can always reach out to her if you need anything. And with that, we would like to say thank you so much, doctor, for being here today. What you've shared is just invaluable information. And thank you so much for it. And thank you so much for your time, taking it out from your busy schedule.
Thank you so much.
Uh,
Thank you so
and
much for giving me this platform. Actually, with this platform, I got a chance to spread this word dysphagia to many of the people.
Right.
I wish at least some people get to know what is dysphagia and come to know, at least they try to follow, take down the steps and try to maintain, or they may also share this information to some other people who are in need.
Right. Absolutely. So thank you, and thank you to all our viewers who are watching. We will close as we do with each webinar or each session of mine with 3 chants of Om. So anybody who feels like joining, please join in. Om. Thank you so much for being here. Without you, there would be no sessions. Gratitude to all of you. Thank you so much, Doctor.
Thank you. Thank you so much.